Hi, this is Junaid, neurocritical care stroke and epilepsy specialist. We're going to continue with our discussion on financial consideration as far as healthcare is concerned. We're going to go ahead and discuss the most important topic today, waste in U.S. healthcare system. There is a significant amount of waste in U.S. healthcare system. It is approaching $1 trillion a year, not $1 trillion in 10 years. $1 trillion a year. That's a staggering amount in terms of waste is concerned. As a matter of fact, this was a study that was originally done in 2019 in which they ended up breaking down. About 18% of our GDP goes to healthcare. Previous studies, according to them, had showed that about 30%, nearly one third of our spending goes to waste. They updated the revised system and then they said that we are around $935 billion annually, which is close to $1 trillion annually in waste. That is 25% of healthcare spending. This updated estimate says that 1/4 of the money that we put in healthcare is wasted. This is ridiculous in terms of wastage is concerned. We already know that there are interventions that can decrease the waste. As a matter of fact, the only category that we cannot account for decreasing the waste is administrative complexity because there is no clinical study to show that. On all other of them, we have clinical studies to show how we can decrease the waste, at least by $282 billion. So we really need to somehow reduce this cost. So as far as 2012 study and 2019 study, as you can see, administrative complexity, which has even gone higher from 27% to 31%. Over-treatment and low-value care has decreased but from 21% to 10%. And these are some of these policies that came out, and those policies reduced physicians ordering unnecessary tests. Fraud and abuse has been definitely cut down from 19% to 8%, but pricing failures continue to be the big issue, especially in pharmacy. Failure of care deliveries, again, is a big issue in terms of readmissions, etc. And failure of coordination care, unfortunately, in this digital environment, in this situation where we can order any delivery at home, we cannot, unfortunately, get good care. So these are the 6 major categories where we waste money in terms of wasting of money. Again, in all of them, over-treatment, fraud, failure to care delivery, failure to coordinate care, we have clinical studies that can save up to $282 billion, except for administrative complexity, because we can't even do a study on that. So this is just really stupid, in my opinion, that how much money we spend in terms of healthcare. That's another big issue. On top of that, how much we waste, which is basically 1/4. Now, they estimated breaking down exactly on each and every step how much we have wasted, and they have taken out ranges from where, and then also broken down each category into further. So, for example, failure of care coordination, unnecessary admissions, and avoidable complications is one of them. Readmissions is another big issue. Again, these have been curbed by some of these policies, but again, we still need to do a lot more to decrease our waste in US healthcare system. These are different studies that they did, like target cost component and target interventions. At your own time, please make sure you do read this paper in its totality, because it's extremely important for all clinicians to learn how much we waste and how we can help our systems to gain through value care and decreasing complexity, therefore saving us money. And that's our tax dollar money, by the way. So it's not like it's going in the air. It's not like insurance is paying it out of thin air. It is literally our taxable money or our pool of money if it is in an insurance company as well. The best book that you want to read is The Long Fix. This is written by Vivian Lee. She is just a fantastic person. And as a matter of fact, there are some podcasts that are on YouTube. You should also follow her on Twitter and LinkedIn. She actually just puts it simply. We pay more for less. Unfortunately, we pay a lot more for less. We waste, we overtreat, we make deadly mistakes, and we practice medicine inconsistently. This is literally her first chapter, and it's just blown away how she simply puts it. And also, more importantly, in her book, she gives at the end some resolution, some ways to help these systems improve their coordination of care so that they can decrease costs. So, fantastic book. What everything boils down to is this. As a physician, as a clinician, if you're going to get into the field, this is what we are moving towards. We are officially moving towards fee-for-service. I order an EEG, I read an EEG, I get X amount of money. That's not how it should be. We have to go towards fee-for-service to value-based care. And the reason we have to go there is that, why did I order an EEG? Was it important enough for the patient? Did it actually improve outcomes? Nobody cares about that. The only thing measurable in our system is action. If you're going to measure action and pay for action, I would love to have more action, right? So that's the problem. So somehow we have to move towards fee-for-service to value-based care. And we have to start paying for outcome, not pay for play. And that's her term, Vivian Lee's in her book. And there are multiple models that are being evaluated and sustained. The most we talk about is value, which is very hard because value, again, all these models have their limitations and their benefits. The best one is technically the value, because if you have a value-based care system, you can pay for outcome. However, it's very hard to measure outcomes, because how do you correlate that outcome to that physician performance? And then more importantly, well, I'm not responsible for a person who doesn't take his medication and then has a readmission for a repeat breakthrough seizure. So that's one of the key issues when you are getting into this particular way of reimbursement. Same thing, risk-based. I mean, especially in higher acuity situations like neurosurgery, obstetrics, etc., then there can be a risk-based model. And then there's a risk pool model, which is one of the accountable care organizations are being provided reimbursement through. This is becoming more and more popular in terms of primary care is concerned. And then of course there should be a hybrid approach, right? I mean, neurosurgeon can be paid through risk model, primary care physician could be risk pool, and then everyone else should have a tokenization where our value is being determined at every point of patient contact and therefore reimbursed through that. This is Jamie Dimon. We have the best healthcare in the world in terms of doctors, hospitals, pharmaceuticals, device companies, but we certainly do not have the best outcome. It sucks that we outspend all of the rest of the countries while on an average we pay double for what we achieve. And then, as I said, the largest healthcare expenditure still remains within the healthcare inpatient hospital care setting. And then the next one is physician and clinical services, which includes nursing care, respiratory care, etc. And as you can see, there's all of that. Other half is also present. Other medical spending, physical therapy, occupational therapy, personal care, nursing facilities, and of course, pharmacy. We really need to make sure that we approach as a collective and make sure that we provide value-based care. And again, while choosing your specialty, you have to make sure, as I discussed in the earlier section, that we're going to be really moving towards acute inpatient care to outpatient care. And one of the last decade was all about preventing readmissions. And this decade is going to be all about preventing admissions. So this is going to be a shifting environment. Keep that in mind. But again, these are some statistics that you should be aware of when you're choosing your medical specialty. Again, I'm very grateful for your time. Make sure you go to the Academy website to check for regular updates. Thank you. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.